Greetings, vibrant viewers, and welcome to Healthy Living. For today's program, Preventing and Reversing Heart Disease with Caldwell B. Esselstyn, M.D. Dr. Esselstyn is a pioneer in the use of a pure plant-based diet to help heart patients regain happy, healthy lives. Dr. Esselstyn, who began his medical career in 1956, won a Bronze Star for his services as a surgeon for the U.S. military in Olac, or Vietnam. From 1968 to the present, he has worked at the Cleveland Clinic in Ohio, USA. He is also past president of the American Association of Endocrine Surgeons, became the first recipient of the Benjamin Spock Award for Compassion in Medicine in 2005, and has been listed as one of the best physicians in the United States. His greatest contribution to the health sciences began when he started a 20-year peer-reviewed study which found that a plant-based diet can help heart disease patients. His findings are summarized in his book, Prevent and Reverse Heart Disease. We continue with Dr. Esselstyn on today's show, to where he'll further share the benefits of a plant-based diet.
Throughout history, there have been entire cultures that have literally lived for generations and generations without ever having this type of disease. And that is with plant-based nutrition. And I think to use that knowledge and that skill and employ it now for patients who have been devastated by this disease is entirely appropriate, because they then become the locus of control for this disease. Right now, we have this peculiar way of treating the disease where we don't treat the disease. We use a thing called angioplasty. If you get a narrowing, we try to come in with a balloon and blow it up.
Wow.
Or we try to bypass it. They don't treat the disease. They are what we call sort of stopgap. Even the persons that do these procedures will agree that these are sort of a stopgap patch job. And the sad thing is, with stents and with angioplasty and with bypass, with the passage of time, there is an erosion of the benefits, and the whole process is extremely expensive. But when you're simply switched to eating plant-based foods and you do it correctly, there is no morbidity or complications to the diet. You don't die from the diet. There's no added expense because you've got to eat. And the most exciting thing of all is that the benefits do nothing but continue to improve, not erode.
Wow.
Dr. Esselstyn explains the foundations of a healthy plant-based diet, which proves to be sufficient in meeting nutritional protein requirements.
When people first start this way, they can understand the causation of heart disease. They can understand that the small changes in how you eat immediately destroy the capacity of the artery to cause all this nasty inflammation, which is causing the disease. The constant question we get is, how am I going to get my protein? Well, you're never going to be deficient in protein if you're eating a wonderful variety of whole grains, all the different wonderful types of beans, vegetables, and fruit. Especially the key here for patients who, for instance, who have chest pain or angina, they have to get their green leafy vegetables. How many people do I counsel with heart disease who can tell me on a regular basis that they're eating bok choy, Swiss chard, kale, collard greens, beet greens, mustard greens, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, and spinach?
That sounds delicious. In your experience in 20 years of counseling patients to go to this plant-based diet, has anyone ever had a protein deficiency?
No, not in our experience with what we've done.
There is the misconception that fish is a healthy meat alternative, but many studies have shown that fish absorb all the contamination in our waterways. So fish flesh is laced with toxins such as mercury, PCBs, DDT, dioxins, lead, arsenic, and a range of other chemicals. Warnings have been issued about the toxins found in fish flesh, and countless research has shown that consuming contaminated fish can have serious health consequences.
A piece of muscle, whether it paws with a hoof, flaps a wing, or wiggles a fin, all muscle is made up of animal protein, animal cholesterol, animal fat, none of which we really want our patients to have. Fish is this whole business about omega-3 fatty acids. And we really are not basically deficient in omega-3 fatty acids. How does the fish get omega-3? From the algae. I'm not saying that our patients are going to get algae, but you can certainly get the green leafy vegetables, and by utilizing flaxseed meal, this is going to give us the omega-3 we need.
According to Dr. Esselstyn, the medical profession is seeing changes where doctors are increasingly interested in learning more about nutrition to better assist their patients towards a more healthful lifestyle.
Just in the last 18 months, I've had invitations from 6 different medical schools. Even though this has been going on 20 years, what happened? All these academic institutions are now beginning to really grasp and want to take advantage of this. We have to have a seismic revolution in health. The seismic revolution in health that is going to occur is going to come when we in medicine have the skill and the fortitude and the will to share with the public what is the healthiest lifestyle so they never have to have these common chronic killing diseases. If you're eating plant-based, how are you going to have obesity? How are you going to get diabetes? How are you going to get hypertension? How are you going to get strokes and heart disease, the common Western cancers, and on and on and on it goes. So there's an increasing awareness of the power of this for the most common killer, which is heart attacks, cardiovascular disease.
You're watching Healthy Living here on Supreme Master Television. Please stay tuned. We'll be right back after these brief messages. Welcome back to Healthy Living on Supreme Master Television for our discussion with Dr. Caldwell Esselstyn, author of Prevent and Reverse Heart Disease. Dr. Esselstyn reveals how brain health is also affected by our diet.
Let's just take one other organ that I think I'd like to talk about for a moment, and that is the brain. I mean, we've talked about the heart, but nothing is quite as important. Because we all know now, for instance, that by age 85, 50% of Americans have dementia. Well, who wants to have a successful life and look forward to that? And there's been some very interesting developments. We know from the work of Megan Cleary and her team of radiologists from the West Coast, when they reported in 2001, in February, at the stroke meetings in Miami, that she and her team had looked at over 11,000 MRIs of the brains of Americans. That is a magnetic resonance image. And what they began to find is that at age 50 in Americans, they begin to see little white spots. What you're looking at here is a nice normal brain MRI. The only white spots you see here are the cerebral ventricles, which have cerebral spinal fluid, and that's normal. But it's a nice sort of uniformly dark area. Now, these little white spots that they're beginning to see in Americans at age 50, we now know are little strokes. Whether you're driving your car, playing tennis, sleeping, Zappo, little stroke. Not a problem, right? Because the brain's got a lot of reserve and the stroke is small. But if you continue to eat the same way and the same lifestyle, now you're 65. And you may find yourself more often than not saying, sweetheart, where'd I leave the car keys? And now you continue to eat the same way and you're 75. And you find yourself more often than not saying, sweetheart, where did I leave the car? And now, if you continue to eat the same way and you're 85, you may look at her and say, are you my sweetheart?
So they recognized a correlation between diet and
strokes.
And stroke.
So
wow.
here you have somebody. Gosh. I think you can see the difference.
Wow.
in these two. In this one, I actually have counted over 90 of these little strokes. But you can just imagine if a brain has all these multiple little strokes and scar tissue, how can all those beautiful messages get through in a coordinated fashion? And so we think that there can be a great deal lessening of the problems of senile dementia when people begin to eat plant-based. And not only do they save the vessels in their heart, but they also save the vessels in their brain. The same is true of your legs and your kidneys and everything else. All the vessels in the body are helped.
So it sounds like there's a lot of medical research now that is proving that a plant-based diet can not only prevent diseases but elongate your health. Is that true?
The main thing is not to have this long period of chronic, debilitating diseases and illness that need never occur. And I think this is the thing that we're constantly striving for, is the quality. This is Dr. Crow's at the time of his heart attack here, and then we see 30 months later what he had done without any operation or without any drugs.
Wow.
Just his own biochemistry that was so changed when he began fully eating plant-based, and kept his cholesterol, as you know, well under 150, and his bad LDL under 80. And that was my excitement and reason for wanting to write this book.
People who feel healthy and have no history of heart disease, would you still recommend them to have a plant-based diet, to switch to that?
Dr. Culler from the University of Pittsburgh, who as a result of his cardiovascular health study had said that all males who are 65, all females who are 70, who have been exposed to the traditional Western diet, have cardiovascular disease and should be treated as such. So even the person that asks you that question at age 50, let's say it's a woman who's 50 who is pretty good health, and but she's eaten the typical Western diet. I've told you already from the autopsy studies of those between the ages of 16 and 34 that that woman who's asking me the question already has a certain amount of disease. More recently, the world-famous Framingham study out of Boston, near Boston, made an observation of people in the village of Framingham that they had 1,000 people who had normal blood pressure at age 50. Those same people by age 70, 90% were now hypertensive, had high blood pressure. And so the plant-based nutrition is wonderful to help control hypertension, especially when you eliminate the salt.
We have some gifts we'd like to share with you. Supreme Master Ching Hai has written a couple of books on the life of animals. And the way that they're connected with a plant-based diet is that not only is it a very healthy way to live your life, but also it's a very loving way to live for other animals. And as you can see, one of the things that we have on our alternative living message is change your life, change your heart, change your diet. And it seems like you have not only proven that you're changing your heart to be more compassionate, but you're literally changing the chemistry and the physical part of your heart, and you're literally opening it up.
Well, thank you. I have to confess, all of my research was strictly motivated to help people. And I guess the way I look at the whole animal situation is that if we have more and more man, the two-legged creature, eating plant-based, well, that'll help his four-legged brethren.
We thank Dr. Esselstyn for his remarkable work and research in how to maintain our health through a plant-based diet. We wish him the best of success and health. We look forward to seeing you again next week on Healthy Living. Our show airs every Monday here on Supreme Master Television. Please stay tuned for science and spirituality after noteworthy news. May you enjoy overall well-being through a nutritious vegan diet.